Next, let's talk about the newer version of thalidomide, lenalidomide or Revlimid. This drug is much more potent in the laboratory to knock out myeloma, and the FDA recently approved this drug for the treatment of myeloma in relapse when the drug is used in combination with dexamethasone. The drug is also given in pill form, but in this case it's 21 daily doses followed by a 7-day rest. The drug can suppress your bone marrow, so as a result, again, just like chemotherapy, your white blood cell count, your platelet count, and your red count can go down. That is, you can become anemic. And although 25 milligrams is the approved daily dose, many patients have to have a dose reduction because of the effects on marrow function. The 21 days on, 7 days off is done in a schedule to allow marrow function to recover on the 7 days off. And again, although 25 milligrams is the approved dose, you may have to have your dose reduced. Like thalidomide, this drug can also cause blood clots in the lung and also in the calves or in the upper legs. It's important to recognize that the dose of steroids has recently been shown to play a critical role in determining your risk of having a blood clot. Less steroids means actually less risk of clot and doesn't impact the ability of this drug to kill myeloma. More recently, the drug has also been combined with Velcade and chemotherapy. The early studies are promising, but because these drugs all affect bone marrow function, one has to be careful when you combine this drug with chemotherapy. The side effects, well, certainly the drug can cause numbness and tingling like thalidomide, but it's less common. I mentioned blood clots, again, particularly something to keep in mind when the drug is used with steroids or with chemotherapy. The highest risk, just like thalidomide, is during the first few months. One can reduce the risk, like thalidomide, with blood thinners like aspirin, Coumadin, or Lovenox. There also is a high risk of severe infection with this drug when the counts drop, but even when they're not low, one can have infection, and the drug can have effects on the heart rhythm. Now, you need to adjust the dose of this drug, unlike some of the other drugs I mentioned, based on kidney function. If the kidney function is poor, the dose needs to be dropped, and that's because the drug is actually broken down in the kidney. So if the kidneys don't work, the drugs hang around longer, and you have to reduce dose. So now that you've heard about the IMiDs, let's talk about arsenic trioxide next.